Good morning to you all. My name is Professor Roger O'Sullivan, and on behalf of the Institute of Public Health, I'm delighted to welcome you to this webinar entitled Physical Activity in the Pandemic, Lessons for Older Adults and Health Professionals. The role of the Institute of Public Health is to help inform public policy to support healthier populations in Ireland and Northern Ireland. Today's event is part of our research programme of publications, events and research on physical activity and older people. A key challenge for public health is to help us all reap the benefits of physical activity and understand the consequences of physical inactivity. As we grow older, we need to ensure we keep ourselves physically active as possible. The goal as we age is to retain our physical and cognitive function and delay the onset of illness and disability for as long as possible. This is a major challenge as typically physical activity levels decline as we grow older. The COVID pandemic has added a new dimension to this challenge. Many of us are staying at home and sitting down more than usual. The pandemic has changed how we connect, how we work, how we shop, how we socialize, how we learn, and most importantly, how we exercise. It can be difficult to do the sort of exercise we normally do. It can even be harder for people who don't usually do exercise to start exercise now. While some people are using the pandemic as a time to get fitter, emerging evidence suggests older adults in Ireland reduced their level of physical activity during the pandemic. However, at this time, it's very important for people of all ages, but especially older adults, to be as active as possible, as it can help both our physical and mental well-being. Therefore, the purpose of this event, with top-class speakers from Ireland, the UK and Australia, is to share the latest evidence, policy and insights from the field. 600 plus people registered for this webinar today, which highlights the interest and importance of this area of work, especially as we enter a period of new public health social measures across the island. So the format of today is that we'll have the ministerial welcome pre-recorded, followed by an older person's insight, again pre-recorded, and then 3 presentations. We'll have our question and answer session at the end of all the presentations. Can I ask you to submit your questions in the Q&A function within Zoom at the bottom of the screen, and my colleague, Dr. Cunningham, will group them and pass them back to me. Please indicate if your question is for a particular presenter. I hope you'll find this webinar enjoyable and informative, and feel free to tweet if you would like using the hashtag #PublicHealthIE. Throughout this webinar, we will also conduct a number of different polls. And so our first poll is on now. So Adam, are you able to put up the first poll for us? So this is a nice start. How many minutes of a physical activity are older adults recommended to engage in on a weekly basis? A nice starter. I feel a little bit like Bob Monkhouse in Family Fortunes. So if you vote now, unfortunately, the panelists and the hosts can't vote. So if you would like to vote now, we'll see the results. Okay. Are they? Okay. I'm also struck by how Zoom has changed how we work and think, but also a few years ago, many of you will probably remember Robert E. Kelly and the famous BBC example, where he was doing a BBC interview, and his daughter came into the room, and then his second child came into the room, and then his wife came into the room. We've become more accepting to the range of challenges that COVID and Zoom presents to us. Okay, so you can see the spread of answers: 60%, 60 minutes, 90 minutes, 120 minutes, and 50 minutes. So well done to everybody. We've got a clear answer of 67%, and thank you, everybody. That is correct. Okay, so we're now going to move to welcome our Minister. Minister Feighan has pre-recorded a welcome to this webinar. Minister Frank Feighan is Minister of State with responsibility for public health, well-being and the National Drug Strategy. He was elected as a TD for Sligo Leitrim in the 2020 general election. After County Tyrone, Sligo is my next favourite county in Ireland because my children believe it never rains in Sligo because we spent many of our summer holidays there. So Adam, are you able to hit play now for, we can now listen to the ministerial welcome. Okay. Okay, so we're fixing the sound at this stage. So we're just going to start.
Keeping older people active.
Okay. Thank you, everybody.
I am delighted to have been asked by the Institute of Public Health to open this webinar on physical activity and the pandemic, lessons for older adults. The Institute is, of course, a vital partner in the development of health policy in Ireland, particularly in light of its role as an all-island body. I particularly want to thank you for hosting this important webinar, which provides us with a great opportunity to assess and review our response to one of the most challenging aspects of the pandemic, keeping older people active, but also keeping them safe. One of the cornerstones of the Healthy Ireland framework is inclusion. Long before the arrival of COVID-19, we knew that some groups in our society needed targeted interventions to ensure that their particular needs are met. Older adults are one such group. The principle has taken on a new urgency since the onset of the pandemic. While COVID-19 has challenged and disrupted the lives of every one of our citizens, we have had to make special provision for those who are most vulnerable. At the outset, my department and the NEFID established a subgroup on vulnerable people as part of our early response to the pandemic. The subgroup has provided oversight and assurance with regard to the measures required to protect vulnerable groups from the virus to the greatest extent possible. Specific guidance for the over 70s and the medically vulnerable has been provided by the Health Protection Surveillance Centre and is available through their website. This guidance has also been supported through public health information campaigns, such as the Government In This Together campaign, and through information networks, including key organisations working with vulnerable people. In This Together has provided lots of advice and tips on looking after mental well-being, staying active, eating well, and staying connected, drawing together a range of activities that can be pursued at home or locally, alone, or with the family members or friends online. The campaign included a special emphasis on vulnerable people, providing information specifically for those cocooning or restricting their movements. It included a wide range of resources with links to online and phone supports for anyone who felt they were struggling, and to services specific to older people. In This Together has simple messages on staying connected and creating a routine, as well as tips for stress reduction and links to services providing a valuable and vital resource of trusted information in one place. Through social media channels, the campaign also called on those who are aware of vulnerable people in their locality to ensure that they were checked on and looked after, either through helping with groceries and shopping or helping them link them with relevant services. The Community Call initiative has mobilised resources and community initiatives to support those who have been cocooning in order to help them to access services. Community Call has been supported by local authorities, An Garda Síochána, the GAA, and community volunteers. As part of this, each local authority established a helpline that vulnerable people can phone if they are looking for basic services such as delivery of food or meals or transport for essential trips. As people get older, it is important to stay active, helping one's body to stay strong and supple, improving balance and coordination, and preventing falls. Physical activity also improves one's mood and energy, helping to reduce feelings of stress and anxiety that are common in times of uncertainty and can challenge one's mental health. Just 30 minutes activity a day could have a huge impact on your health. Resources such as those provided in the In This Together campaign, Sport Ireland, and other partners have been very valuable in promoting the need to remain sufficiently active, even when restricting numbers of contacts or cocooning. We are now heading into the winter months, which will this year pose unprecedented challenges for our health services across the board. And for older adults in particular, in the coming weeks, we will be launching the next phase of our communications campaign, which will focus on the theme of resilience and of minding your mental and physical health and well-being throughout this year in the context of COVID-19 restrictions. Our clear message is that whatever people are going through in terms of reduced social contacts or in isolation, we should all stay as connected and as healthy as possible, helping to strengthen the community and individual resilience, restoring hope that we can and will recover and make it through this together. I have no doubt that today's webinar will make an important contribution to our work in this important area. Thank you.
Thank you, Minister, and thank you, colleagues, and thank you, Martin Grant, our Communications Officer, for working with the Department of Health on bringing that video together. That was excellent. We're now going to move over to hear Adrian Gurley. As we're discussing physical activity and the pandemic and older adults, we wanted to hear the voice of an older person, so we're delighted to share a short video from Adrian Gurley, who is an older person in Northern Ireland and an advocate for AGNI. But also, before I do that, I want to encourage you to do three things. The list is getting longer. One is to please submit questions in the Q&A box at the bottom of your screen. Secondly, you can stand up and watch this video. Please do that. And thirdly, if you're on Twitter, feel free to use the hashtag and highlight your thoughts and important messages coming out of the webinar today. So we're now going to hear Evelyn from Northern Ireland. Thank you.
Up and stretch your spine. Don't lift heavy loads. And if trying to pull anything out. My name is Evelyn Gurley. I am 80 years of age and I come from Bangor, County Down, Northern Ireland. I have always been physically active all my lifestyle. Now, some 20 years ago, I was diagnosed with osteoarthritis in both knees. But my doctors stressed that the best thing I could do was to keep exercising. Even if my knees were painful, take it easy for a couple of days or a week, but try and do exercises, even if it was just in my chair. And I've always try to exercise as much as possible and get out and walk with my friends. I know some older people are restricted from being active during the pandemic due to illness or lack of mobility, but I would encourage people to do exercises at home. You will find that it will strengthen your legs and give you confidence to get up and move about. I know I will be delighted to get back to my activities when they resume after the pandemic. And I will know that I have remained active in these times, and I will be able to take up my different interests when everything gets back to normal again. So I would advise a lot of older people to try and do as much exercise as you can. Move with Mary is easy, it's fun, and you can become addictive to it. This is good. Then step into a space. Give yourself room to swing both arms and march with.
Okay, so thanks, Evelyn. That's a great inspirational video, and also thanks to HNI, Pascal McKeown and Siobhan Casey, who connected us with Evelyn, and HNI have the Move with Mary program. Before we go to our next speaker, I just wanted to, we'll do two quick polls. So our first poll is our poll is poll 2. So Adam, are you able to? So prior to COVID, across the island of Ireland, how many people aged 65 plus did not get enough physical activity? Okay, so if you want to give your answer to that, so that's another knowledge question. Okay. And again, I would encourage, feel free to submit a question. You may have a pre-prepared question, but of course, you'll probably have more questions whenever the speakers come on board to do their presentations. So you want to share? So 11% think it's 1 in 5, 19% think it's 1 in 4, 35%, we've got a draw, think it's 1 in 3, but actually the answer is 1 in 2. People do not get enough exercise age over 65. We're just going to do another quick poll because this is just it's about you. So since March, if we take March as the period where we entered different public health social measures, could you indicate, has your own level of physical activity increased, decreased, or stayed the same? The good one on this is there's no right or wrong answer, it's your answer. So it's to give us a feel of the people in the webinar today. There are 345 people here with up to 600 or over 600 registered. So we may have more people throughout the day. Okay. So it's good positive news, 37% increased, but on the other hand, 34% decreased and 30% stayed the same. So thanks very much, Adam, for that. Just also, I should say, Adam is our resident expert on IT, and he's working his magic behind the scenes. He's the manager of ICT and communications in the organization. Okay, so I'm delighted now to welcome Adrian Bauman to present us today. Adrian is a great speaker. I've heard him a few times before. He's also very dedicated because it's evening time in Australia. Australia is 10 hours ahead of us. So Adrian is Emeritus Professor of Public Health at the Sydney School of Public Health and co-director of the WHO Collaborating Centre on Physical Activity, Nutrition and Obesity. He's a leading authority on research relating to health consequences of physical activity and very, very focused on the importance of translating research. And Adrian always poses you a challenge when he's speaking, because he challenges some of your assumptions about what you may think is correct or not. So Adrian, you're very welcome, and thank you for taking part today.
Good evening and good morning. It's a pleasure to be with you in Northern Ireland this morning. And I'm going to talk a little bit about physical activity in the elderly from a COVID perspective. I'll give you a few other perspectives and some work that we're doing and how COVID has influenced that, and look at the literature a little bit. We have a WHO Global Action Plan on physical activity that's giving us all a framework for a systems approach to physical activity at all ages. And the concepts in the Global Action Plan are changing social norms and attitudes, having spaces and places that are safe and convenient for people to be active, giving people specific programs and opportunities, and having an overarching framework, which you're doing very well in the island of Ireland compared to many other places. But this applies to the elderly too. We've had WHO produce world reports on aging. A couple of years ago, I wrote a complete epidemiological and programmatic review of how to promote active aging, and you're welcome to that reference. I'm happy to share my slides. But when we think about physical activity in the elderly, it comes in many forms, and many of these forms are much more difficult to do now that we're in the middle, particularly in the Northern Hemisphere, of the COVID epidemic. You can't have walking groups, cycling groups need to practice distancing. You can't have mass indoor meetings in gymnasia or halls or exercise referral programs as much as you once could, depending on the level of shutdown in your particular location. But more importantly, the physical activity needs of the older old, the institutionalized elderly, people over 80 or 85 years of age is even more difficult in this particular period because it's harder to get programs to them because of the shutdown's effects on isolating the elderly and their own anxieties and fears about transmission, both within institutions they live in and out in the general community. We also don't need to have unrealistic portrayals of implausible active aging, because that's not what we're actually dealing with. When the media shows us that, it makes me a little cross, because it's really representing 0.001% of older adults. It's not actually telling us what we can do for the mainstream of older people in our communities. But this photograph that I took in Havana in Cuba 4 years ago is what we should aspire to. In every village and town and suburb and region in Cuba, there's a central square. And in that central square, there are people exercising in the early mornings of all ages, from baby exercise programs to people in their 80s. And they're all participating as part of the way they lead their lives. Everybody does it before work, and everybody uses the free outdoor equipment regularly, including many older people really in their 70s and 80s. So that's what we need to aspire to. The only bit I don't like is the dog is tied up over here in the corner. Okay. When we think about the prevalence of participation, and we've heard just a bit earlier that it's 1 in 2 older adults in Ireland, we did a paper a few years ago where we actually looked, yes, a lot of older, this is a New South Wales in Australia population survey of 5,000 adults over 65, and 80% were walking, but far fewer were doing things that related to strength or balance. So when we looked at the prevalence of balance, challenging, and strength activity, it was more like 1 in 20 or 1 in 25 adults that were achieving that particular target. And that's really important, because for older adults, we need more than just large muscle movement. We need strength training and balance training to prevent falls, to prevent frailty, to delay the onset of frailty, and allow older people to be more functionally capable in their activities of daily living. Okay, not going to talk any more about that. We're in unusual times where, in a time of COVID, things like, and this is a picture from the Heart Foundation of Australia with one of their older adults walking groups, aren't happening, well, they are now in Australia, but they wouldn't be happening in your environment as much as they once did. There's lots of literature on this, and there's a slightly mixed picture. But the first thing to say is, you as an audience of 300 or 400 people listening to this are atypical. More of you have increased your activity slightly more than have decreased your activity. I think it was 37% to 34% in the data Roger showed that you did in poll number 2. That's not how the rest of the world is coping and finding it. More people are missing out on their total daily activity. They're doing less incidental activity because they're confined to home, and fewer are doing activities that they might have done, going to a class in their seniors center or community center, going for a walk. Those kinds of things are happening less often. So overall, there are many studies, but in general, they show that less activity is happening during the COVID pandemic, and that's particularly less amongst older adults 65 and above. And when you look at Fitbit data from across the world, you can see most countries are red. This was a study done in May. And the countries that are most red, where the greatest decline in Fitbit step counts occurred, were the countries like Spain and Italy that had, and Argentina, that had the worst incidence rate of COVID cases in their communities at that time. So really, we're less active during COVID. And there's lots of data from the European Commission. There's data from an Apple Watch intervention that shows a drop, quite a precipitous drop during March in the Apple Watch app that in daily step counts amongst anonymized users of those. We did a study where we looked at interest in activity. And how did we look at interest? We looked at whether people were Googling exercise and home equipment, and there was a huge surge in interest in exercise equipment and exercise just at the time of COVID. In fact, that was as great a surge as we saw in the surge in Netflix and other online media and resources. But what this shows is that people are interested in activity because suddenly it's something they can become interested in. It doesn't show that they actually translated that interest into activity. They might have even bought equipment. Bicycle sales have gone crazy in Australia, but you don't see more people out bicycling other than in the first week of the purchases. Everybody can exercise at home, and I'm showing you this because this is an example of the kind of things that older adults won't do at home. Here are young people enjoying highly aerobic, highly energetic Zoom classes, and that's not the situation for older adults. For older adults, it's mostly being isolated, that's physically, emotionally, socially, and being less active as a consequence. Initially in Australia, because we didn't have complete shutdown, you could still go out in the community, but there were no exercise classes, no gyms, no structured programs. So we saw more people out running and more people out cycling and kids out cycling on bikes that had never been used. But much of that was displacement from people who had personal trainers or gyms because all they could do was go out and run. So that was flooding the running tracks and the walking paths and the cycling paths. But overall, structured activity has gone down, especially in the elderly, and incidental activity has almost disappeared if you're under strident kinds of lockdown during the pandemic. So let's think for a few minutes about what kind of solutions and actions might we think about now, especially since we're likely to be with the pandemic for a little while longer, especially in the Northern Hemisphere as you're moving into winter, which is worse in two ways. One, the virus tends to like colder temperatures, and secondly, you can get out less and social distancing becomes more difficult. Firstly, a systematic review that my colleagues at the Institute for Musculoskeletal Research at Sydney University did, looking at step counts in older adults, using interventions using step trackers, Fitbits and pedometers, and they showed a 2,000 steps per day increase in walking in those exposed to that kind of intervention. That's exciting because what it suggests is that older adults respond to that kind of intervention quite well as younger adults, where a 2,000 step increment would be on average typical for all pedometer and Fitbit type of interventions. So the first thing is giving older adults tracking devices is effective and is something we should think about. Secondly, there's a lot of mythology that older adults are not internet and web and social media connected. They are. They have smartphones. They use Facebook. In fact, young people don't use Facebook these days. If you ask anyone under 30, they'll say, oh, Facebook's only used by older people. And we've actually demonstrated for cardiac rehabilitation patients in their 60s and 70s that we can get Facebook groups going quite easily, and they're quite keen on them and can adapt to them quite easily. These are not necessarily highly mobile. They may have a lot of comorbidity, but the concept of using social media and web-based apps for older adults is something we should really think about quite seriously, particularly in this particular COVID period of time. We can use coaching for healthy aging. We've just started a trial called the Change Trial, where we're going to be using coaching, and we're going to be doing it by telehealth now rather than by face-to-face coaching only. And we can also think about that as a mechanism for getting to older people in evidence-based ways to get them to move more at levels that they can cope with, at levels that they're comfortable with people running the programs who know how much older adults, the younger older adults, not the over 80s so much, but the younger older adults do in their daily lives. We also need to not forget strength and balance, that I think are probably the most important things we can do for older adults, because in Australia, falls is one of the leading causes of hospital costs through hospital admissions and morbidity for people over 65. And preventing falls, we've got all the evidence, we know what to do. We just need to implement it at scale to get to enough people to improve strength and balance, particularly balance, to reduce the incidence of falls. And physical activity and structured exercise of particular balance supporting kinds is the best thing we can do for that purpose. And finally, some work that I've been doing for several years with very good colleagues in British Columbia, in Canada, in Vancouver, with Heather McKay and her group at UBC, the University of British Columbia. British Columbia is shown here in red, and it's got twice the population of Northern Ireland, and it's got 67 times the area, because I looked it up. So basically, it's a lot like Australia, except colder. It's mostly nothing. It's mostly just wilds and forest and snow and ice. It's got lots of communities. It's got very high numbers of Indigenous Canadians, and I'll talk more about that in a minute. And we did a project called Choos to Move that was part of the active aging strategy of the provincial government of British Columbia. And it was a scaled up evidence-based intervention based on champs from the US and scaled up to reach remote communities and older adults across British Columbia. The concept was we worked with recreation managers who worked with communities, who worked with activity coaches, who recruited people in their local community who were Choos to Move participants. The coaches really were able to run group programs. The social support was an important component as well. Group programs for these older adults in many communities and many settings. They brought people together, and the initial outcomes suggested we increased physical activity, we improved mood and connectedness, and decreased loneliness. So then we got repeat funding to scale it out even more, and we're now in several hundred communities across British Columbia, including quite remote, tiny communities, hundreds and hundreds of miles from any other community. Okay, why is this relevant? It's relevant because everything had to stop when coronavirus emerged on the scene, because people couldn't turn up to their senior citizens, their community centers to participate. So that what's happened to Choos to Move is it's moved itself online, and we've got the same concept, coaches and group programs and people getting to know themselves, but tailored for really people in their 70s, but we're doing it online at scale. And people are still enrolling. We're still getting people across the province engaging with it. And really, by moving it online was an incredibly strategic thing. It took a bit of technology, but it enabled people to keep engaging and new people to start engaging even more than before, because we actually don't need to be where they are. So it's an important conceptual thing. We've got to make structural leaps from what we're doing to doing it in a different way to cope with COVID. So to conclude, my main message is we need to demythologize the concept that free living older adults can't use online technologies. We've got to create interventions and programs for them that use social support, social media platforms, and use programs that they can access. And these are scalable and affordable. They're probably less expensive than other things we would do in physical activity for the elderly. So that's an important step for us in immediately, and starting to do that kind of thing, translating what we have done for older adults. Otherwise, as a report that came out this month from Age UK, a charity, we'll have deconditioning, increased frailty and reduced mobility, which will be problems for older adults well beyond the COVID pandemic. And we really need to prevent that by starting to introduce programs now. And that's really all that I had to say. So I'll please stop sharing my screen and we'll go on to the next speaker. Thank you.
Thanks, Adrian. That there's brilliant. I'm really struck by the things that become scarce during COVID. Bicycles and fitness equipment. I think that's reflected most certainly in Ireland and the UK when I was trying to update our bicycles. So we're now going to move on. I should say we're having a great discussion in the chat function of this Zoom. Adrian, there were loads of comments on your presentation. Some of them I note about the weather differences in different countries, and I'm sure we're going to get onto that in our Q&A. But now we're going to move on to Dawn, who's going to make a presentation. It's a great pleasure to introduce Professor Dawn Skelton. Professor Skelton is a professor in aging and health in Glasgow, Caledonian University. Her recent research has focused on the determinants of sedentary behaviour and interventions to reduce this in older adults. Dawn chaired the Older People's Panel for the update to the UK's physical activity guidelines published last year. And Dawn is going to speak to us today about translating physical activity guidelines for older adults, bridging the gap between theory and practice. Dawn, you're very, very welcome. Thank you very much.
Thank you. Can I just check that you are seeing the slides okay?
Yes.
Brilliant. Okay, so I'm tasked with translating the physical activity guidelines for older adults and trying to bridge the gap between theory and practice. We had lots of great images from Adrian of older people engaged in physical activity. Of course, in these times, it's not so easy to use that equipment or get out and about. But also, there's a very, very large difference between a fit, active 65-year-old, a sedentary 65-year-old, and someone who's 90 but actively aging, for example. So each of them potentially might still try and follow those physical activity guidelines, but the way in which they might achieve them is different. And in fact, as you heard right at the beginning of this webinar, unfortunately, a lot of older adults are not meeting the guidelines. And so when we have a conversation with them, to suddenly say you should be achieving 150 minutes of moderate to vigorous physical activity is too big a difference to where they are now, and they probably just stop listening. And we learned a long time ago not perhaps to put the moderate to vigorous physical activity guidelines at the head of the conversation, but perhaps to start with sit less, move more, build your light activity, move into more moderate to vigorous physical activity as you find it more, you're more able to. As you heard also at the beginning of this webinar, participation rates remain very low. The figures that were given for Ireland are very similar to the ones from Scotland. These particular figures are from Scotland, and it's the proportion of adults and older adults meeting both the aerobic and the muscle strengthening guidelines. So if you just look towards the right-hand side of the graph, the 55 plus, you can see that 55 to 64, it's less than 20% are meeting both the aerobic and the muscle strengthening, and it's down to less than 8% of over 75s. During COVID, Sport England has been doing a physical activity survey on a regular basis and has found that about 40% of older adults are doing less activity than prior to COVID. So essentially, we are looking at quite a big drop in the number of people getting anywhere near these guidelines. And as you heard also from Adrian, different countries, different dates, essentially that stay that came in, activity restrictions still exist. And as we also heard, we have a rehabilitation pandemic facing us. Not only the older adults that might have contracted COVID and the prolonged fatigue problems that can occur afterwards, but also those that have become deconditioned, avoided going and getting healthcare, or indeed were in rehabilitation programs such as falls programs or exercise after stroke, which suddenly then these were not running anymore, so they couldn't access them. So what's been happening to their bodies? Well, rather a lot, unfortunately. We know there's an awful lot of research about sedentary behaviour. Most of it is epidemiological research, in other words, where people have had physical activity trackers, and we just know that those who are more sedentary have more problems with health. But actually the acute effects of sedentary behaviour, which we see with bed rest or going into hospital, are very clear. So we've had problems with range of motion and stiffness. People will start to have unfortunately lost muscle and probably are losing bone. We've got poor venous return, so they're more likely to be dizzy on standing. Postural hypertension levels would have gone up. A reduced kinesthetic awareness. When you're outdoors and moving about and chatting to people all the time, your head's moving all the time. So your vestibular system, one of the key inputs, is constantly being challenged and combined with your eyes and the information from your eyes for your brain to keep you upright. And of course, all of these things have been stripped from us. And then there's the issues of loss of motivation, feeling of helplessness, loss of control, and all of these things actually mean we sit more as well. So research on sedentary it's still an emerging topic. There's a lot more research in adults than there is in older adults, but there's a few things here, a few studies here which are clear. We know that people who spend significantly more time sitting, irrespective actually of whether they're meeting the guidelines at other points in the day, have reduced muscle strength, reduced physical function, in particular their ability to do chair rises and timed up and go. They are more likely to have reduced bone strength and a higher likelihood of developing osteoporosis. They have an increased risk of falls and fear of falling, lower quality of life. There's a recent study to suggest they also develop urge urinary incontinence. And then there's the issues with our metabolism. Blood glucose, body mass index, waist-hip ratio, and cholesterol are all higher in those people that sit for prolonged periods. And of course, as we age, lots come into our lives that affect physical. I've just highlighted some of those. At retirement, interestingly, there's quite a big difference between those who had very manual jobs and those that didn't. Those that had very manual jobs are more likely to be more sedentary at retirement and therefore develop the ill health problems associated with prolonged sitting. We're more likely to take on caring duties. We're more likely to have started to have potential falls and therefore potentially be avoiding activity. And of course, if we go into hospital, we know that within a week you can lose between 10 and 50% of your functional activities of daily living by being completely inactive in hospital. So all of these things will interrupt also the movement patterns of that older population. I'm not going to read these out. We've already heard we're aiming for 150 minutes of moderate vigorous physical activity, aiming to build strength on at least 2 days of the week. We're aiming to improve balance on at least 2 days of the week, and we want to minimise sedentary time. So all older adults, those sets of guidelines exist. But as I was saying, there's quite a big difference in what people do and don't do depending on their health and physical function. But it's fascinating because we heard, a fair number of you knew the 150 minutes, but actually most professionals are not so aware of the other guidelines on strength and balance. So we know, for example, on 2 surveys from the 2011 UK physical activity guidelines, that less than 20% of health professionals that are the ones that will precipitate movement in their clients didn't know the physical activity guidelines, and therefore they're the key stakeholders in grabbing attention and making movement an important part of health. Okay, so why is strength and balance important? You heard from Adrian, it's important to be able to get out of a chair, to be able to get out of the bath, to be able to get off the floor if you fall, to be able to use the stairs. All of these things require a certain level of strength and balance. And the top green line on this graph is essentially looking at successful aging, where you don't actually cross a threshold of ability to maintain independent living. And the blue line is when perhaps you don't age so successfully and you'll cross that threshold much earlier. It is possible to postpone that threshold crossing, and most of the evidence in the past has been physical activity, the endurance scale, if you like. So thinking more about light activity, building into moderate and vigorous. And probably for the 30 years, the majority of research will be about that moderate to vigorous activity, less on the sedentary or that's growing. And we're now starting to see a lot more research on the light activity for older adults as well. And interestingly, the less active they are, the quicker they feel the benefits. And that's brilliant, because when you want to encourage and engage somebody in activity, what you're after is finding the win-win tasks that change habits. And so what's so lovely is that if somebody is particularly sedentary, it doesn't take an awful lot for them to feel a lot better, to feel a lot more stable, to feel a lot more strong, because they're at that point at which the impact really shows or feels very quickly. But as I said, there are different types of older adults, and they will move between these depending on whether they spend some time in hospital, they take on caring duties, or indeed they find a great class that they love getting involved in. So we have the actives, those people that have perhaps maintained activity quite well into older age, perhaps still take part in a regular amount of moderate to vigorous physical activity. We have those who are in transition, so things are changing in their lives, they're starting to feel difficulties doing some tasks, maybe are starting to avoid some tasks. And then you have frailer older adults, although they really hate being called that, and I totally understand that too. But those who are having more difficulty might require support with walking aids and might require support in the home. And let's face it, these people all still need to try and achieve to those physical activity guidelines, but things are very different on how you would start that process. And there's 3 really nice downloadable documents which professionals can get hold of on the website on this slide, which just talks about the different ways at which you might approach working to achieve those physical activity guidelines with those 3 different functional groups. What about the actives then? I mean, essentially, they might well be achieving some moderate to vigorous physical activity, but the chances are they're still sitting for prolonged periods of time in between. They're patting themselves on the back for doing their 3 times a week class or whatever, and then they're sitting because they feel they've done their bit by doing their classes. They often have energy to do the things they want to do. They're likely to be quite steady on their feet, and they may already be taking part in preferred physical activity types. This is an important thing because physical activities don't always reach all the components of fitness. And so if they are only a regular walker or only a regular swimmer, they won't necessarily be working on the strength and balance aspects as well as they are on the moderate to vigorous physical activity aspects. So really we want to start by encouraging more multiple types of activity that cross all the components of fitness. We want to think about more regular physical activity throughout the day, more light activity rather than bouts of moderate and sedentary behaviour in between. We want to perhaps talk to them about transitioning to do slightly more vigorous activity. So the guidelines state that you can do 75 minutes of vigorous and it's roughly equivalent to 150. Ideally you want a mix of those, of course, and additional strength activities if they're not currently engaged in those. Are they meeting the balance guidelines? Well, not so easy to see this slide. It's quite small print, but you can see at the bottom a free access paper that you can read these about. But this is a review of different physical activities and whether they have a good or less good effect on muscle function, bone health, and balance. And I guess I just want to pull out one key thing, because one of the most common activities that older adults engage in, or that we recommend they engage in, is walking. Walking is a great activity. It allows social connectedness. It allows you to get to where you need to get. But actually it doesn't have an awful lot of an effect on muscle strength or balance unless you're going to walk on uneven surfaces or up hills. So really we want to promote other activities, a range of activities that will target some of those strength and balance deficits as well. So thinking about that area of highest impact where you can work with those who are perhaps not meeting the guidelines down at the lower end of the sedentary continuum, then essentially now we're thinking more about those who are in transition. Those that, if we could get more active now, are less likely to become frail later. These are generally people which again sit for prolonged periods of time. They perhaps tire a bit more easily and therefore avoid activities that might make them tired. They might be starting to get a bit unsteady on their feet, and they may have informal help, perhaps a little bit of formal help, but essentially independent living. Chair-based opportunities are of limited value to this group. Ideally, you want them to do as much in standing as possible. So gentle seated exercise for this group is not helpful. Essentially, you want to sit less, move more. You need to concentrate on standing strength and balance activities so they become more stable in walking and in standing, which means they're more likely to engage in other moderate to vigorous physical activities as time goes on. You want to aim more at increasing the volume of light activity first before you move into moderate and then transition as time goes on. So it does require support. And just before I move into the frailer older adult, I thought it'd be a good idea for you guys to have a try. So these are very small graphs on the left, but hopefully you can look at the PowerPoints afterwards. But essentially, these are what's normal levels for being able to do chair rises. How many chair rises can you do in 30 seconds, or how long you can stand on one leg. I'm not going to do the chair rise, but I am going to suggest that you stand up for a minute, have something nearby for support to hold on to if you need to, because believe me, you will not be as good as you think you are. And I'd first of all just like you to try and stand on one leg. Don't mind which one. Just lift the other foot off the floor slightly and hook it behind the other leg, and just see if you can manage about 30 seconds. If you're under 50, you should happily manage 30 seconds standing on one leg. If you're over 50, as you can see in the graph, there's a rapid decline in the ability to stand on one leg. But it's important that you can regain that with practice. For those of you that manage fairly stably to do that, I want you to try one more thing, and this will be a lot harder, so please make sure you have some solid support next to you to hold on to if you need to. I'd like you to try and stand on one leg, but this time close your eyes. Many of you would have felt much more wobbly and have had to put your foot down immediately. And that's because as we get older, we start requiring more of the input from the eyes and listening less to the input from the sensors in our feet. So as I said before, practice makes perfect. Spend more time on one leg, perhaps clean your teeth on one leg, and carefully try to get used to standing with your eyes closed, because that will start getting the other balance sensors working working harder for your brain. So moving into the frailer older adults, essentially, we start seeing losses of functional abilities. On the left, in bright multiple colours, you can see a variety of different functional tasks. And basically, as you come further down, you're going to require more formal care to maintain independence. And you'll see the optimal curve. That's if you age as well as possible and actively as possible, and a suboptimal curve when essentially you'll lose those tasks much more quickly if you avoid activity. So in the frailer older adult, they again sitting for prolonged periods of time, they're fatigued very quickly. I mean, a half-hour or 1 hour class online or in a group for a frailer older person is too much. They're not likely to come back because it's going to take a huge amount of their energy to do that long. So we need to consider shorter, more regular activity blocks for them so they build up their capacity, their stamina. Chair-based activities are a place to start with frailer older people, where we're building strength, confidence, and we progress slowly to standing activities. Ideally, think about regular hourly sit to stands. Can they set an alarm on their cooker, on their phone? Can they do something that just makes them stand on an hourly basis? Start linking those tasks to everyday activities. So for example, if they're watching television, could they stand up 4 times in every advert break? So building volumes of light activity and short bouts of moderate activity, which will help over time reduce fatigue. I'm not going to spend too long just looking at the time, but essentially there is more and more evidence that light activity, particularly for the frailer and those in transition, will make quite a big difference to unplanned hospital admissions, future prescriptions for health conditions, and improved bone health. So we know if we could get people to sit more, to stand more regularly, to build in more light activity at this level of function, we will have quite big health effects. And one study I just wanted to draw your attention to was the stomp out sitting study, where essentially people had a monitor that was stuck onto their leg and vibrated. It knew if they were sat, and it vibrated once an hour in their waking day. And they had to stand up for 30 seconds to stop the vibration. And essentially over about a 10-week, 12-week period, we had significant improvements in chair riseability and timed up and go. No actual exercise apart from the sit to stand once an hour. So at lower levels of function, you can have quite big improvements fairly quickly. And this, of course, means that people will feel more stable to do more standing activity, move more into moderate activity. So what works best? We want programs that have a mix of aerobic, strengthening, balance and flexibility. We want to have safe places for walking indoors or outdoors, with places to sit for those who are frail or in transition. We need to get programs that encourage older adults to encourage other older adults to get involved. There's nothing like a bit of peer support. And essentially, if there's a particular reason you're referring someone on, such as falls, then you obviously need specific specialist activity advice and a plan of action. Exercises are not just, that's not what they're all about. Exercises will work, but only if someone will do them. And so goal setting, social connectedness, involving people in groups, highlighting successes, all the things that make somebody want to come back and do some more. They're really important. Think about a range of options, because people have choices. They don't like some things, they like others. We need to think about cost. We need to think about single or mixed group. And of course, nowadays, even though we've had lots of conversations on the chat about access to online and digital programs, it's perhaps the only way we can go for many at the moment. I have mentioned in the chat box that paper-based programs do work, but again, only with regular telephone support. Someone will not just do an exercise program because you post it to them. Try and involve older adults to be someone like me, because a range of older adults are not all very fit, but a range of older adults can make such a difference if someone feels that someone like them is participating and enjoying. So I'll just leave you with some key things for action for practitioners to think about. Plan programs that people want to come to. Generally, that means there's some fun, there's some social connectedness as well. Emphasize the benefits that older people identify themselves. So it's not all about reducing risk of heart disease. It's not all about necessarily weight loss. It's being able to play with the grandchildren, maintain independence, etc. We want to explain and communicate the importance of balance and strength, because they're really important components of fitness for old age. And we need to make sure that people want and recognise that things are useful for them. So we want to market our programmes appropriately. And of course, we need to adapt those programmes to the needs of those participants. And so that's my talk. Thank you very much.
Thank you very much, Dawn. That's brilliant. And thank you again for sharing the exercise. It challenges me every time that when I go on one leg, it's fine. When I close my eyes, I just notice the little wobble. So, and I've used it as well. I think it's a really, really good example. So just before we go to Deirdre, I just want to say hello to our students in Athlone. I understand we have a third year class of students in Athlone IT, so you're very welcome today. So we're now going to hear, I'm delighted to welcome Deirdre Lang, who's Director of Nursing and the National Lead for Older Person Services and Clinical and Integrated Programs in the Health Service Executive in Ireland. Deirdre coordinates the Get Up, Get Dressed, Get Moving network. which is working towards developing a sustainable model to embed the concept into culture and practice across the health and social care. And with that in mind, Deirdre, I'm looking forward to hearing your presentation. Thank you very much, Deirdre.
Thanks, Roger. And I'm just going to turn off my own video because my broadband is, of course, acting up today. If you can't hear me, would you just jump in and let me know? So it's wonderful to be here and to follow on in relationship to one of my favorite subjects, get up, get dressed, get moving. And you can see from the lovely picture on the right, which is Professor Muirgray's paper, Sod Sitting, Get Moving. So let me just tell you a little bit about why I got involved in doing this piece of work. If I can get my screen to move. Okay, so what I wanted to do was, I suppose, Adrian has talked about superagers, and the lady on the left is chronologically 80 years of age. The lady on the right is biologically 80 years of age. And when I got into this role as a Director of Nursing Older Persons Lead within the HSE, I was very much aware of the fact that we all assume that the lady on the right, the biological age, is how we have to age. And while Ernestine Shepherd, who is my hero on the left, is chronologically 80, that's how I want to myself strive to age. I don't want to be seen as frail, and I don't want to be frail. How on earth, though, do I get to live in a way that's a balance between those two ladies, that I'm not becoming frail and that I stay as fit as possible? Because there is an ageism out there. Not all old people are frail, and not all people living with frailty are old. So you can have a 20-year-old person who's frail if they have a severe enough illness, or a 50-year-old if they have a chronic illness. And one of the things that's really important around COVID is the fact that you can have two comorbidities and be less frail if you're socially connected. And COVID has made us socially disconnected. So having those same two comorbidities and being lonely can decrease or increase your frailty levels. So I'm just conscious of the audience that we have, and I'm just going to explain what we know about frailty, just so that we have a baseline in relationship to that. So frailty is a distinct health state, and it is related to the aging process. However, it's heterogeneous in condition in that people present differently, in that every person who's older presents differently and appears differently. It's characterized by decreases in physiological capacity, and that's across multiple body systems. It's a risk factor for adverse health outcomes, and it is a transition phase between healthy aging and disability. We also know that the recognition of frailty is really important, and it should form the part of any interaction between an older person and a healthcare professional. But in order for that to happen, people need to understand what frailty is. An individual's degree of frailty is not static. It can be made better or worse depending on the care received when an individual presents to a health professional. So how do we see frailty? Well, I have been to a number of universities, including Athlone, so hello Athlone, and I've asked students using Mentimeter to quite really use the words they would use to describe frailty, and it is exactly the same as this wordle here. So you can see words like horrible, not me, helpless, can't do anything, skinny, little old lady comes up 3 times, and that's probably because there's more little old ladies, because older people, women live longer than men. Shriveled, little, lots of littles. So if this is how we see frailty, it's no wonder then that we see words in medical care such as acopia. Now, acopia is the most lazy of diagnosis. It means I don't know what's wrong with this person, so I'm giving them a label. Having that as your diagnosis does not allow for medical assessment and treatment. So it is, in fact, ageist. Off feet, again, what on earth does that mean? Is the person levitating? What does off feet mean? And how does that fulfill a plan of care? Pleasantly confused. Can you imagine anything pleasant about being confused? Mechanical fall. So what does that mean? They fell over a Zimmer frame, or there's something wrong with their body, the mechanisms in their body. Bed blocker. And this is something we hear quite often, and it's very ageist, and it means that the person who is unable to get home because of our system is to blame. The elderly, and I don't particularly like the word elderly because I feel it is othering, because when I talk about the elderly, it's someone else. When I talk about an older person, I'm older than someone else, and I'm hoping to get older and become an older person, because the alternative isn't really great. And what we've got in 2020 are two new wonderful words, cocooners and the vulnerable. So again, othering. And so if we continue to see frailty in this way, and we allow ageist attitudes, we will continue to see things like this. And this is a study of 615 participants who, and it looks at the functional decline in those admitted to hospital. They're over 75 years of age. You can see from the dark grey graph that this is their baseline activity on admission with activities of daily living. The middle graph is on admission, and you can see that that has increased, and you would expect that in an acute illness. But on discharge, you can see that they have not returned to what we would call their baseline. And in fact, there's functional decline, and that I would describe as harm. Research suggests that decline in walking ability occurs in nearly 60% of hospitalized older adults and begins within 2 days of admission to hospital. And in our hospital setting, we are extremely risk averse. And the older you are, the more risk averse we are. And we know that people are more risk averse about others than they are of themselves. So we ask people to sit quite a lot. Older people in hospital have a 23% risk of being unable to return home and requiring nursing home placement simply because they've lost the ability in some basic activity of daily living during even a short hospitalization. We have caused harm. And if you were in a room with me, I would suggest to you to look at the person to your left, because evidence suggests that up to 50% of older people become incontinent within 24 hours of hospital admission. So that's the person beside you or yourself. You can choose which one of you you'd like that to be. And that is not acceptable for me or my older self. One study highlighted that 65% of older people were deconditioned after 48 hours of being in hospital. And of those, 2/3 failed to improve before discharge and 10% deteriorated further. We also know, we've heard this earlier, more than 1 in 4 adults are physically inactive, spending up to 12 hours a day sitting. And when in hospital, they can spend up to 73% of their time in bed, which is about 20 hours. So knowing all that, we couldn't just sit there. So we did a call to action. So the Office of the Nursing Midwifery Services Director in the HSE and the Health and Social Care Professions Office, so an interprofessional approach, made a call to action at a seminar one day and asked people to join a campaign. And the campaign we call Get Up, Get Dressed, Get Moving. And it works to a similar way that Brian Dolan's End to PJ Paralysis works. And what we've decided is our purpose is to create a scalable, sustainable model of Get Up, Get Dressed, Get Moving that can be adopted and implemented at home, in the community, and across all health and social care settings. Because our initial thoughts were we were going to start this for the acute hospital setting. We were going to have patients getting up, getting dressed and getting moving in the acute hospital. But we realized that we need to capture the hearts of people much sooner before hospital, because people coming into hospital tend to adopt the sick role, don't bring clothes in with them, and then we're at nothing. So we need to get that message much earlier. And as Adrian and Dawn have said, it's about getting moving younger so that you have a pattern and activity and a habit of moving. So our network has grown over the last 12 to 18 months, and we have 200 members, and these are just some of the people that are involved with us. So you can see the Institute of Public Health, which we're delighted to have, Ciel Bleu, and I saw Thomas is on earlier, a number of hospitals, a lot of researchers, a lot of academics. So Athlone, you're not with us yet, so you need to sign up. And then health and social care professionals from across the range of acute hospital, residential care, community care, mental health, intellectual disabilities, and of course the Age Alliance. So we have the Active Retirement Association, Age Friendly Ireland, Alone, we have the Age Parliament, and a number of other Age Action, and a number of other and Age and Opportunity. I can't forget them because they're key to us. And then the GAA have joined us, and Sports Ireland have joined us. Now the GAA are a silent partner at the moment because they just are too overwhelmed with work. But it's the spread of being able to get our message, not just within healthcare, but across the spectrum of health and social care. And this is what our foundation is on. Within the HSE, we have Make Every Contact Count, which encourages all health professionals to make every contact with a patient count, no matter where that is. And we're asking them to make every contact count around activity, and also around the whole foundation of social prescribing, because we know that it's, as Dawn has said, it's that connection piece that's really important to the social prescribing in relationship to activity. And our target audience is all adults living in Ireland who access health and social care. So that's at home, in the community, in residential care settings, and in the acute hospital. That includes the general public, people living with a mental health illness, and people with intellectual disabilities. Our work streams have been around defining what Get Up, Get Dressed, Get Moving is, because that's different things to different people. So Ernestine Shepherd runs and she lifts weights, but someone else might only be able to sit to stand or to furniture walk around in their house because they have functional decline or they've been very unwell. And our definition was developed through a number of workshops and a number of surveys where we honed down the definition from a large number down to one. And our definition is: getting moving encourages individuals to participate as their ability allows in all aspects of life, covering self-care, domestic tasks, getting out into the community, leisure, activities and social life, and to maintain their physical and mental health. So that covers the range of people. And we are trying to reach those hard to reach groups of people who may be living in an isolated area, who are unable to access exercise, who probably are not on the internet, who maybe just have the television or the radio. So there's a wide gambit of people that we're trying to contact and connect with. And that's where the health and social care Make Every Contact Count comes in. Our communications are around looking how we're going to bring the message to people, and we're starting on that now. Our resources are looking at things like what Dawn has shown us in relationship to policy, and to having posters and resources and packs available for the different health and social care professionals in their different areas. And then education. So we're looking at working with health and social care and nursing educationists within the undergraduate and postgraduate programs to promote this concept within the sphere of education. And then we need to consider COVID and the older adult who's living with frailty. And this is just a recent and a really, really good graph that Jamie Kirwan et al. have presented just recently. And I've asked, could we use this? Because I think this really explains to us the issue of deconditioning and reduced activity during COVID. So you can see that where people are contained, there's social distancing, there's self-isolation, and there's travel restrictions. That's led to lifestyle behavior changes where there's decreased activity, decreased step count, increased sitting time, and we're all watching far too much television. We're also really more anxious, and that decreases our sleep quality. And then the COVID stone, as I call it, where we're all eating that bit more as comfort eating, and maybe we're not eating as well as we possibly could, because going to the shops in itself is a stress. And if you can't get out to go to the shops, you're relying on others to bring your shopping to you. And thank God for Alone, who's been so good within the community of older people in Ireland. Mechanisms of muscle loss then, so there's decreased vitamin D, and we know that Tilda are constantly telling us that people need to increase their vitamin D supplementation, because that will help in relationship to the severity of COVID. And then with anaerobic, decrease in anaerobic activity, our insulin sensitivity has decreased, we're losing muscle mass, and our acute body composition changes. So our loss of muscle mass and function leads to sarcopenia. Sarcopenia increases falls, potential of falls, and then we've added more fat to our body, so we're more sarcopenic obesity. And that is going to lead, ladies and gentlemen, to some severe frailty going forward. Long-term health risks of cardiovascular disease and diabetes will increase, more fractures and osteopenia and depression, increased frailty, and decreased quality of life. So this is a really, really serious concept in relationship to older people and activity. And it's amazing how good getting up and moving makes you feel. Just a little anecdote was one of the members of our group, Peter Ward, who's a physiotherapist in Bauman Hospital. His mother had had some surgery and she remained in the pajamas because that's what you do. You're in the sick role, so the pajamas are the way to be. And he kept nagging at her about getting dressed, just even getting dressed. And of course, the prophet is at nothing in their own land. So someone else mentioned to her the fact of getting dressed. So she got up and got dressed and put the makeup on, and she texted him and she said, I feel so much better now. So for all of you who are not members of our Get Up, Get Dressed, Get Moving network, our network is established as a group of equals, and we've chosen the word network particularly, equals, so it doesn't matter where you come from, who you are, or what interest you have. If you have the shared goal as we do, you could please join us. You don't have to participate in any work streams. You just need to be available as someone that we can network in with. And for example, a lady called Etty heard about Get Up, Get Dressed, Get Moving, and she wrote a fabulous song, which probably will become our theme song. And that's only because she loved the concept of it. And that's her contribution to what we're doing. We might make her famous, and she wasn't expecting that. But our whole concept is about something is better than nothing. You're never too old or never too young to start. Thank you.
Thank you, Deirdre. That was really great. Thank you very much. And thanks also, Deirdre, for highlighting the great work of the volunteering community sector in Ireland and the support that they provide. That was really great. Just a few things before I just have to remind everybody, we've got the hashtag Public Health IE. I don't want to show favoritism to Ask Loan. We actually have 63 students registered from Dundalk. So hi to everybody in Dundalk. There's lots of discussion in the chat section and requests about the presentation. And just to confirm, this webinar is being recorded. And so then that means you'll be able to see the slides after this event. We're going to do another quick poll. So before we go into the panel discussion, and we've had 3 great presentations. So if you have any more questions, and we have loads of questions, but feel free to send them in. So Adam, can you pull up poll number 4? So this is about where you get your knowledge from. Again, it's just your experience. Where do you get your knowledge from about physical activity? Okay, so is it the media? Is it family and friends? Is it social media? Is it from work colleagues or fellow students? Is it health professionals? Do they refer you on and talk to you about physical activity, or others? So if you want to have a quick vote, we'll close this now very soon. We had 325 people at this stage. So this is quite interesting, because the panel may want to reflect on this. Media, 16%, family and friends, only 2%. That's quite an interesting thing, you know, as somebody who trained originally as a sociologist, the implications of family and friends. Social media, 20%. Now, I'm sure the panel will have a view about social media and messaging. Work colleagues, 17%. I want to highlight in the Institute of Public Health, to promote physical activity and moving when we're working at home, we've got dedicated time during the week to actually do physical activity or to move more, which is really positive, forward thinking. Health professionals, 28%, and others, 16%. So that's quite interesting. We'll maybe come back to that in the panel discussion. Let's go to our final poll of the day. So this is looking to the future. So Adam, do you want to? Okay, so thinking about the future over the coming months, do you think your activity levels will increase, decrease, or stay the same? Okay. So if you think back in March, and now we're thinking about the next period, increase, decrease, or stay the same? Okay, so we're just about to close that poll. So that's really positive. It may also reflect the audience that we have, because we've got students and a lot of health professionals. So, but well done to those who expect their activity. Let's ensure that if you buy the bicycle or the fitness equipment, you actually use it. Decrease 12 and stay the same 35. So thank you very much. Now we're going to move into the panel discussion. We've got about just under a half an hour, probably in the region of 20 minutes to 25 minutes to ask a few questions. And my colleague Conor Cunningham has been working behind the scenes, bringing together the questions. So we'll start off with Adrian. You've been to Ireland a number of times, and you'll recognise that we're entering a different stage of weather at this of the year. So as we enter another phase of the COVID pandemic in Ireland and the UK during the autumn and winter months, what do you as a panel see are the challenges and key messages for physical activity at this time? Weather came up as quite a common theme in the chat forum and the discussion, so we've grouped that together. So this next phase of COVID and the change in the time of the year. Does anybody want to start and share their thoughts? Adrian?
Interestingly, a country to the north of you, a much colder country, which is Finland, they're actually more active in the winter than they are in the summer. When the summer comes and it reaches a paltry 20 degrees centigrade, the Finnish people are so hot that they're lying on rocks like lizards. But in the wintertime, they're cross-country skiing. They've got ski runs around their little villages, which are floodlit. They're all out walking and hiking in snowshoes. They're playing ice hockey. They're very active in the winter. So the first thing is mythologize seasons. We have the reverse problem as we move into a hot summer. Inland Australia gets very hot. And other countries I work in the Middle East and Gulf states get up to 35, 40 degrees, 45 degrees, so that you can only be active at the extremes of the day. So we've all got to adapt to our climate and work out how we can work around that. Now, someone also asked about kayaking and outdoor sports. Some of them might be harder for you to do in Ireland, but you can walk, you can hill walk, you can hike, you can go out and do things in groups. There are all kinds of things, and in the many interventions that we've got around sporting events where people can actually engage in peri-event activities, it's still possible to be active. So we use climate as an excuse for not doing anything rather than it really being a barrier.
Okay, Adrian, thank you for that. Dawn or Deirdre, do you want to add? Yes, go ahead, Dawn.
I totally get the point, because I live in the north of Scotland, so it gets very cold up here, and it is already very cold. What we have to remember is that being more active means you generate heat. Naturally, your own heat. And actually one of the things that we have seen in a couple of small pilot studies is if you get care home residents moving on a regular basis, even if it's seated, they start turning down the heat in the care home because people are generating so much of their own natural heat. They don't require the temperature to be risen quite so high. I'm not suggesting we're all trying to turn off heating to make sure we exercise, but a reminder that strengthening exercise and warm up and aerobic activities generate heat. And so we should be encouraging people to move more inside their homes in winter, which means that potentially they're not going to have to wrap up quite so much and potentially might be able to keep their heat down a little bit.
Okay, and
just
Deirdre.
A different angle.
Yeah, Deirdre.
So we're not connected as much in our COVID world, but things like 100 days of walking. So my daughter's fantastic because I'm a hurry up and I have to keep pushing myself. But if I was saying to my daughter during 100 days of walking, we're going for a walk and it's 30 minutes it was. So getting out of bed, even if the weather isn't great, and I knew it was only 30 minutes, then I would go and do it, especially if I'm part of something that is bigger than me and connected. So I think we really need to push that whole connectivity and that intergenerational connectivity, because my future older self wants to feel part of what's going on.
Thanks very much, Deirdre, and thanks to all the panel on that. I'm struck by one of the observations I have about physical activity is that so much of the physical activity we learn when we're growing up is group activity. But as we grow older and we leave school, it's that bit harder to do group activity. And Deirdre just touched on the issue of, your daughter encouraging you and motivating you. And that's just a nice example is a number of years ago, we did a walk-in challenge in our organization, and we broke ourselves into teams, and we were very lucky. We had people who really were very enthusiastic in our team, and in fact across the organization, and that meant that we were encouraging each other to walk and take part. When we tried it again, not in teams, we didn't go as far. The first time I think we got to Moscow, and I think the second time we got to Paris, but Paris is still very nice to walk to virtually. Now, let's take our next question. Have you any thoughts, and it's been touched on, just some key messages, just to emphasize how we reach and encourage those who need to take part in physical activity the most? How do you reach and encourage those who need to take part in physical activity the most at this time? Have you any thoughts? Or because it's a question researchers always get asked, how do you reach the hard to reach groups? And by the nature, they're hard to reach, but we have, we all have gems and thoughts about that. So do you have any thoughts about how we reach and encourage those who need it most to take part in physical activity at this time? Dawn.
I think your last poll highlighted something I wanted to mention, that. And that was it only about 28% of health professionals have received their advice from health professionals. we know that people are more likely to listen to significant others, and that isn't always friends and family, unfortunately. But we do know that if a person of renown, repute, a health professional, talks to you about physical activity, you're far more likely to think about doing it. Your intentions might change. Sadly, physical activity is not part of a routine conversation, as you can see from that poll result, and yet it's as important as giving up smoking or losing weight. Or so I really think the best route would be for all health social care professionals to actually just start talking about being active all the time, because then it will become normal, and more people will start thinking about doing it.
Dawn, can you remind us from your presentation, not this one, but the last time, where you indicated how many health professionals in the UK could recall the physical activity guidelines?
It was less than 20%. So it's 20% of GPs and 16% of physiotherapists. So, you know, if admittedly they might have known one bit of it, but they didn't know the broader picture. But I think it's so important that it just becomes normalized, that people just ask about how active you are in any conversation, as opposed to only coming up at the point at which they're transitioning to frailty and you have to do something about it. So I just think it should become more normal for health professionals to automatically discuss it, and just ask people how they're getting on in the same way they ask about their diet or their smoking.
Okay, that's it. So go ahead, Deirdre.
Sorry, Roger. And that's why our foundation stone in Get Up, Get Dressed, Get Moving is make every contact count. So if you're in WIT or Athlone, or you're a health professional out there, please access Make Every Contact Count on the HSE land, and please use absolutely every contact you have with your patients, your clients, to promote activity. Don't do it in a negative way. Do it in a way that promotes mental health, that you will feel good, that you will be able to sit to stand, that you will be able to, all the positive stuff, and make it your ambition that your patients will not leave you without having heard that.
Thank you, Deirdre. Adrian, do you want to add anything to that there?
Only that there will be some people who are very difficult to reach during the COVID pandemic, who are demotivated or low active. And that's very difficult, because one of the key clues to older adults is getting social connections as one of the hooks to get people motivated and interested. So that's a particular challenge to which I'm not sure we have any clear answers. Okay.
Thanks, Adrian. Thank you. A reoccurring theme in the presentations was around ageism and language narrative. What do you think public health policy through physical activity promotion and health professionals can do to challenge the narrative around older people and physical activity? Like Deirdre, you know, that those are two great images you started off with. I've seen different examples of that as well, but what can we do to challenge the perceptions and narrative around ageism, but also around physical activity? So there's two parts to that question. Deirdre, do you have a thought on that?
Lots. I could be here. You could be here all day. So the first thing is, ageism is the only ism that's against myself. Right. So we need to put that out there. I want to be old. I am going to strive to be at least 90 odd. Thank you very much. And upright at the same time, and able to look after myself. So how do I possibly do that? Well, I don't look at other people as them. It's part of who we're going to be. And so there's a few things in this. First of all, people need to understand the aging process. So we need to educate people about aging. We need to challenge language that is ageist. And we need to ensure that older people are part of any research projects we do. So the longitudinal study on aging, and in the north you have Nicola, we have Tilda, and in the UK there's Elsa. Those studies use people from 50 years of age upwards, and they do research with them to be able to provide data that can then inform policy. So very much so, it has to be part of research, it has to be part of education, but we as individuals need to challenge ageism.
Thank you, Dawn. I see you nodding your head. Do you want to add to that?
I think there's emerging evidence from research that programs that work better engaging older adults in physical activity are ones which are co-produced and developed with older adults. So in other words, the marketing, the way that words are presented, the way the programs are presented, if older adults are involved in that early stage, their uptake is much better. So, you know, let's make sure we actually are hearing the voice and hearing when we're being ageist. So, you know, the images we use, the way we present things is vital, and therefore involving a range of older adults in our marketing and in our development phase, I think is vital.
Okay. Thank you, Dawn. Adrian, I see you nodding your head. Do you want to add anything to that? Okay. I'll, you know, as the moderator, I'll share my thoughts on physical activity, and I think it's about part of the challenge in promoting physical activity is how we were introduced to physical activity in younger years. It was often about success and about excellence rather than enjoyment. And I give this example about arts and creativity. When my children were younger, I encouraged them to paint and to draw, and it was for the enjoyment of it. And then when they went to school, they did a little bit of drawing and art and colouring in, but then they were advised to stay within the lines, and there were only certain colours that should be used on different parts of the page. And as they went up through school, they did less and less arts and creativity. And then they went to secondary school and it became a subject, and that's a subject they could drop unless they were very good. They might have carried it on at GCSE or Intercert or A-level or Leaving Cert, or maybe go to university. But then when you retire, people say to you, do you know arts and creativity is really good for you? You should do it, it's really enjoyable. And I think there's something around physical activity on that as well, that the messaging has often been in terms of excellence rather than enjoyment. Any thoughts about how we reframe our messaging? And I'm happy you can disagree with me. It's just my thoughts. But any thoughts about how we reframe our messaging, Adrian?
Three or four things. Firstly, people who are active throughout adult life are more likely to be able to maintain it. And we heard that from your guest presenter, the older woman who was 80, who said, I've been active always and I'm continuing to be active. So it's building incidental activity into your lives. Secondly, concept of activity as enjoyment has a number of dimensions, including the social dimension, and that's a way of marketing it to older adults. We shouldn't be calling it exercise. Even if we're doing strength training or balance training, we should be calling it activity for fun or movement. And that's exactly what Deirdre's program seems to be marketing. And I think that's a very important thing. And thirdly, just to answer one of the other related questions on something called, does self-regulation theory work so well with older adults? And it doesn't, because older adults are not motivated by scores and timing and competitiveness and how many steps, but they do habituate easily. So once you can get older adults doing something, they'll stick to it because they like to do the same thing every day. So we've got to get habits to happen, but not self-regulatory theory out of our fitness trackers or our monitoring devices.
Thanks, Adrian, for covering that question, because that is exactly, I was hoping we were going to cover the issue about behaviour change and getting the patterns onto that. Dawn or Deirdre, do you want to add anything to this about behaviour change?
Absolutely. Almost any theory of behaviour change talks about something becoming a habit. And, you know, we know from lots of old research on this that sometimes it can take up to 6 months for a physical activity to become a habit in younger adults. Certainly it seems to be a lot quicker in older adults. And that's partly why we've been involved at Later Life Training in doing these movement snacks 3 times a day, because 8 o'clock in the morning, noon, 4 o'clock are times that people don't come all 3 times necessarily, but there are some which are there every morning at 8 o'clock, you know, whether they've still got their cuppa or they're still in their pajamas, and they do their movement snack because it's become a habit to come online at 8 o'clock and say hello to everybody. And the social connectedness and the fun is vital. And so the other thing that I think is important is tying things into everyday tasks, because if you can tie a movement pattern into an everyday task you're doing regularly throughout the day, it just becomes normal to do that. And it's I think habit's the most important thing we need to try and aim for. And that's why sometimes group programs which perhaps only meet once a week, they don't really get into a good enough habit to change behavior, except turning up that once a week. So we need something to encourage people to do things in between as well.
Thanks very much, Dawn. Deirdre, do you want to add anything to that?
Yeah, for me, there's something around the messaging. So we all know 30 minutes a day, 150 minutes a week, and two days. Well, the majority of people know on 2 days strength training, but it isn't happening. And there's something in the message about why it's important. And so for me, Ernestine Shepherd was my sort of moment, my Damascus moment, if you like, where I thought, oh, I don't have to be frail when I'm old. I can actually be. And it was so then now my weight training, no matter what, doesn't get left behind, even if I don't feel like it, if I don't feel like getting up and getting dressed and getting moving. I think about the future and I think about why for me. So it has to be something that hits home to my own heart, captures my own heart. And that's what I think this Get Up, Get Dressed, Get Moving campaign can be about, is how do we capture the hearts and minds of the nation that they get up, get dressed, get moving? Because it's not just about the fact that, well, I won't get a heart attack when I'm 70. What about now? What about feeling better now? What about a future where I'm well?
Very good. Thank you, Deirdre. And I think that's really powerful, the message about, it's that idea about the messaging around physical activity, that it's for you now, but it's also for the future. That's brilliant. Okay. We've another question that groups up a number of the different themes. What can we learn from other countries in terms of promoting physical activity during the pandemic? Are there any examples that you want to share? Because what have you seen, or have you seen anything that you think is working well about promoting physical activity during the pandemic? In IPH, my colleague Conor Cunningham, along with the communications team and myself, we produced a number of infographics about how to do home-based activities, and they've been really, really useful. We're going to share them with people after this webinar. Does anybody have any thoughts about countries that are doing it? Deirdre?
I'm going to promote Ireland, if that's okay.
Go for it.
Yeah, so we have some really good people, and I know there's some of them online. We've Ciel Blue, we've Age and Opportunity, and we've others. And they have been doing for those people who they could connect with. So there's a lovely story. One of my colleagues, Alison, who works in the Matter Step Down unit, was doing her postgraduate in gerontology, and she decided to look at Get Up, Get Dressed, Get Moving. And during the pandemic, her father is an older man in his late 70s, and he would huff and puff to get up off the sofa. So, I mean, going out to a coffee shop for him in good times was just a disaster, because everything was a big deal to try and move in any form. And she took a video of him getting up off his sofa pre-pandemic. And then his wife just decided to give him a clip on the ear, and she said, we're going to do this Ciel Blue every day. And so they took out the iPad and they did Ciel Blue every day. And then Alison took a video of her dad and her mum after about 4 or 5 weeks of just getting up, sit to stands from the chair. And this man, who literally had to pull himself and his weight up off the sofa, was now sitting to standing with no arms on his chair, and was smiling, had lost body weight. His whole attitude and demeanor was completely different. And that was down to that activity. I think that's phenomenal. It's so simple. It cost them nothing. Ciel Bleu gave. It's about generosity. It's about sharing.
Thank you. I think that there's great. Adrian or Dawn, do you want to share any thoughts about on learning from other countries, or on? Oh, sorry, Adrian.
I want to share a contrary thought, or perhaps a contrarian thought, which is that physical activity people like us and all the people online as soon as the pandemic started, we started developing resources for how to be more active, and they exploded. We started surveying people on how active you are during the pandemic, and they exploded. After I'd answered about 15 of them, I just started deleting them. And there was a plethora of resources and videos and programs and classes, and we didn't evaluate them. We just kept on developing them. So what I'm suggesting is that our enthusiasm needs to be tempered by good evaluation to see what these programs are actually doing, who they're reaching. Are they reaching those that used to go to group exercise classes but now don't have those, the older version of the younger people running in the parks? Or are they actually reaching inactive, isolated older people who are low active? And I think we need to challenge ourselves with the resources we make and evaluate them too, rather than just think we're doing good at the population level. So that's my broad perspective in many countries.
Adrian, that is brilliant. I think the importance of evaluating that we're not marketing or sharing our information with the usual suspects. And that's the challenge. And most certainly that is a really important point. And it's one that I think, as I'm interested in interventions, as you know, I'm always interested in actually ensuring that intentions are well informed, not just well intentioned. Okay, so Dawn, do you have any thoughts on that?
Not so much countrywide, but region-wide. So there's been a couple of comments, and totally get that, about even though there's been an explosion in number of older people accessing digital devices during COVID because family are trying to keep in contact with them, there's still a small number, and it's smaller the older they get. In Tyneside, they put a 10-minute TV show on, so 10 minutes every day of movement and exercise for older people, and they're still running it. And it's very accessible for those people who either don't follow paper-based programs or don't engage in online things. And I have to say, I'm chair of the British Geriatric Society Rehabilitation Group, and we've been trying to get a regular daily TV moment of exercise on, and every single time we've just been hit with, well, no, we can't afford to get the celebrities to come on every day. And I'm like, why does it have to be a celebrity? But the point I'm getting at is that we need to think about those people that don't access online and would never perhaps have joined in the groups anyway. And if something became a 10-minute every day at the end of the news in the morning or something like that, I think you'd have much bigger engagement, because generally it's not necessarily the best quality, but it's usually quite fun. And really what we're after is getting a habit, aren't we, and making something more interesting. So I would like to see a bit more of that, a little bit more of, let's get something on the radio, and that takes skill, or onto the TV, so that people will actually just engage and see it every day.
That's brilliant. Thanks, Dawn. I was just thinking in terms of, if we could encourage people to stand when they're listening to the 2 minutes of the news that happens on the hour every so often, or to stand during advertisement breaks, only if they're short advertisement breaks. Okay, look, we've got a few minutes left, and here's, I think, will probably be my last question. How can we best keep active, bearing in mind the public health social measures that are impacting upon travel and use of facilities? Have you got a message out to people about how to best keep active during this time? So it's that kind of, it's in many ways a summary. It's like the elevator pitch of pitching this, and I'm not sure how high our elevator is, but Deirdre, do you want to?
I'll jump in. So Dawn has said, it needs to be your habit, and it takes 21 days, I think, or 21 times to make a habit. Something in psychology on that. But it's everything matters. Everything counts. So it doesn't have to be a marathon. You don't have to do the 5 kilometers and back. It needs to be something every day that you've challenged yourself to, so that today it's 200 steps more than it was. And I'm conscious that most of the people who are on are people who are up and active. But my concern is those people who aren't, those people who are in isolation, those people who are on the 4th floor of a building and they're sitting in a sofa and they're buying in a pizza and they have no activity at all. They're the people that I think we need to be making contact with. And RTE in television are going to be doing a piece on a regular basis around that, so we can capture them that way. And as Dawn has already said, the radio and the television are key, because unless you're looking for it, you're not going online to find it, are you? But there are things, something every day, even if you do yoga. I can't remember what her name is. Oh, my daughter just shouted, yoga with Adrian. She has something like 6 years of podcasts and they go from 10 minutes to half an hour, even if it's just that. Just challenge yourself for your future older self and be a role model for now and do something every day.
Okay, thank you. Dawn, do you want to share some thoughts on that? Just your pitch.
I'm just going to share some thoughts about not being able to get out of your house and things that we should all do, actually from about the age of 30 onwards. I would challenge you to clean your teeth on one leg. Please swap over, or you get very good on one leg, not the other. So hopefully do that at least twice a day. And I'd like you, of course, we're meant to spend 2 minutes cleaning our teeth, so that gives you a minute on each leg. I'd like you to increase your sit to stands, and you can have a little set of pebbles or something that you can count, that you're doing this over time. You can fill your cup with things throughout the day, but try and add an additional 15 to 20 sit to stands in your day throughout the whole day. And if you have access to stairs, try and walk up and down those at least an extra 5 times a day, because stair climbing is fantastic physical activity for older people.
Thanks, Dawn. Thank you. Adrian, do you want to share any thoughts within the context we're going into? Okay. No. Okay. Thank you, everyone. That's us coming up. We have a minute. I have a minute to say the concluding comments, but I want to thank the panel for being a great panel of speakers and sharing their insights and giving us all challenges. Thanks again to the Minister for his input, and also to Evelyn. Also, thanks to the ICT team behind the scenes. Adam has been keeping us online. Just to remind everybody, the slides and the video will be available, and there will be an update email sent out early next week with some of the resources. Thanks again to Connor, who worked on the questions behind the scenes, to Leah, who looked after the administration, James and Martin as well for their work from comms, and thank you all for giving up your time. We kept 264 people to the very end, which I think is remarkable, and now you've sat for quite a while. So I would encourage you now to get up and get active for the next while. So thank you all, and thanks very much again. Bye-bye.